guys, welcome back to the Medicare Masterclass, and welcome to Lesson 5. I know you've watched a lot and might be brain fried, but appreciate you sticking with us. It's good information and good stuff to know for your Medicare experience. So in this lesson, we're talking about enrollment periods. As we mentioned in the previous lesson, you can't just change plans whenever you want. You do have to have a qualifying enrollment period to make a change. And so we're going to talk about those times that you can make changes and know that it's not just once a year. There's actually quite a few different times that you can make changes depending on your plan. So first thing to get out of the way, Medigap or Medicare supplements versus Medicare Advantage plans. Medigap or Medicare supplements are regulated by federal and state laws regarding insurance, aka your state's Department of Insurance. They oversee everything for those types of plans. Medicare Advantage and prescription drug plans are overseen by CMS, which is the Centers for Medicare and Medicaid Services. Completely different organizations. Because of that, completely different rules and completely different enrollment periods. So the rules do not apply, or they do not have the same rules applied to them between each type of plan. Let's dive into that. So starting with the Medigap or Medicare supplement enrollment periods, basically in a nutshell, you can change whenever you want, but you are going to potentially be susceptible to underwriting. So there's two terms we want to consider here, guaranteed issue and underwriting. Guaranteed issue means they're not going to ask you health questions and you can get on the plan regardless of what your health is. You have this right when you are first eligible for Medicare, and it's called your open enrollment period. There is also a trial period for in your first year that you are eligible for Medicare, you decide to try a Medicare Advantage plan. It's not for you. As long as you make a change to a Medigap plan before that first year is up, you can get on one, no questions asked, guaranteed issue. This same trial period applies if you've only been on a Medicare supplement, never been on an Advantage plan, and you want to try one out. You have a year trial period that if you decide it's not for you, again, no questions asked, you can get back on a Medicare supplement and they won't underwrite you or ask you health questions. Some other more rare cases this applies is moving out of the service area, and this is usually very state specific. Because they're overseen by the State Department of Insurance, they have different rules regarding when guaranteed issue rules apply. So not every state is going to honor this. And it's because, if you sign up for a Medigap plan in one state and move to another, it's still going to work. You can actually still keep it if you want. So that's kind of more of a rare circumstance. And same thing with losing previous coverage. In the rare case that your Medigap plan goes away and we call it terminating, it cancels on you, then you have a guaranteed issue right to pick something else. But again, it doesn't happen, and it also doesn't apply if your Medicare Advantage plan decides to cancel and you wanted to go to a Medigap plan. So those are your guaranteed issue rights. After that, again, you can change whenever you want, but you are susceptible to underwriting, where they're going to ask you an extensive list of health questions that if you say yes to any of them, they will either deny you coverage or rate your premium higher to compensate for the extra risk. They do take into account pre-existing conditions, unlike Medicare Advantage plans and, if you remember, and if you're familiar, individual or Obamacare plans. So, and the reason being, they are much more comprehensive in coverage. They are almost near 100% coverage, which is pretty good. I mean, the Cadillac plan for people new to Medicare, you're basically out of pocket a few $100s each year, and that's it. It pays 100% for the rest of the year as long as Medicare covers the service. So because they're taking on that much risk, they have to take into account pre-existing conditions. Now, Medicare Advantage and prescription drug plan enrollment periods. These, you do have to have a qualifying enrollment period to make a change, unlike Medigap, where you can change anytime you want, pending you pass underwriting. So the first one is your initial enrollment period. This one only happens when you are first eligible for Medicare at 65. It says you take your birth month, which we'll use mine as an example, December, and go 3 months before, so November, October, September, and 3 months after, January, February, March. So from September to March is my 7-month initial enrollment period when I approach 65. That's your time to get set up in Medicare, sign up for Part B if you need to do so, and choose a supplemental policy. And your Medicare will start on the first of your birth month, in my case, December 1st. Or if you are in your birth month and haven't signed up yet, it'll usually be the first of the following month, just because, well, you can't go backwards in time. So that's your initial enrollment period. Similar to the initial enrollment period is the initial coverage enrollment period. Basically, same rules. It just applies to someone who has delayed Part B. So maybe you work past 65, retire at 67, and because you've had creditable coverage this whole time, you're fine. You sign up for Part B, and then still 7-month window. It's just based on when your Part B starts instead of when you turn 65. So same kind of rules. The annual enrollment period, or AEP. This is the most common one you are going to deal with. So every year from October 15th through December 7th, this is your time to make changes. That's why there's lots of advertisements, lots of commercials, because everybody wants your business. Just prior to this period, your plan will send out what's called an annual notice of change. It's basically a side-by-side comparison of here's your plan this year, here's your plan next year. You can decide if you want to stay on it or shop around. You can stay on it and not have to do anything, and your plan will automatically revert to the new changes. However, if you do want to make a change, you can make as many changes as you want, but they're going to take your last change, and that's the plan that will go into effect starting January 1st of the following year. So, most common one, and you're going to deal with it every year. Just know you do not have to make any changes if you don't want to. But if you do, it is your time to do so. All right, the next one is OEP, or the Medicare Advantage Open Enrollment Period. It runs from January 1st to March 31st. And basically it's designed for those people who didn't get a chance to make a change during the annual enrollment period, or they did and maybe had some second thoughts. So the one caveat is you must be enrolled in a Medicare Advantage plan. That is the one rule. So you can't be in just a drug plan. You can't be in a Medigap plan. You have to be enrolled in a Medicare Advantage plan. But you can make one more change during this time. So nice to basically extend that annual enrollment period per se. So it's pretty nice. Outside of those time periods, you must qualify for a special enrollment period. These are usually triggered by life-changing events. And I've got a few examples there, such as moving out of your plan's service area. If you receive assistance from the state or qualify for Medicaid, you can actually change once a quarter. If you qualify for Medicare due to being disabled or have a chronic condition, you can get on Medicare early. This is not a comprehensive list. There's quite a few different special enrollment periods. But just know, you do have some freedom to change throughout the year. So if you want to see if you're eligible for anything and don't want to wait till October, please let us know. We'd be happy to help you out and see if you may qualify for an enrollment period to make a change right now. All right, Part B enrollment. This is a note on this. It doesn't apply to everybody, but it's something good to know. You must have a valid enrollment period to enroll in Part B. So if you remember back to our first lesson with Original Medicare, Part A, you are entitled to as a legal citizen and you've paid your Medicare taxes for 10 years. Whether or not you decide to take Part B or keep working, you'll have Part A, no cost to you, when you turn 65. Part B, you may or may not have to sign up for it. And in a later lesson, we'll explain why. But basically, if you are drawing your Social Security benefits prior to 65, your Part B enrollment is automatic. If you are not, you need a qualifying enrollment period, such as your initial enrollment period when you turn 65, or losing employer coverage so that you can sign up for Part B later, creating your initial coverage enrollment period, and same thing, special enrollment period. If you miss a qualifying enrollment period time to enroll, you will have to wait until the general enrollment period. I don't like whoever bright idea it was to set this up this way, so please have some creditable coverage or get Part B so you can avoid this headache. So it runs from January 1st to March 31st. And so if it's April 1st and you miss that boat, you have to wait a whole year to sign up for Part B during that January 1st to March 31st window. And then your Medicare will start on that July 1st, a few months later. Don't know whose bright idea that was, but basically that means it's forcing a late enrollment penalty on you. So please have creditable coverage and get Part B when you can. And you will avoid this headache and avoid a very unnecessary late enrollment penalty, which unfortunately sticks with you for the rest of your life. So this concludes Lesson 5, talking about enrollment periods. If you have any questions, please reach out to us. I mean, there's plenty, if not 100 different enrollment periods. So if you have specific questions for your situation, we'd love to answer them for you. So thanks for listening. We'll see you in the last lesson.